So let's talk about the Enneagram for Physicians, and we're talking about the type 2 space today. So doctors for years, centuries, millennia have this persona image. We have this perception of conception of the doctor. They're a learner, they teach, they're healer. They're also a giver, a supporter, a provider, someone who's generous and gives in their healing. And we have a little bit of different system today. Some physicians care for patients directly. Some have a less clinical, less or not directly relating to a patient's specialty. And there are plenty of doctors that have non-clinical careers altogether. But there still remains this sense that doctors are givers and they provide and they're generous with what they have. And that's in a way also ingrained in part of the societal perception, what we learn in medical school, residency, and as an attending physician. And it is this, how shall I say, this space of being cared for, knowing that you're nurtured, you're nourished, that you have plenty to give because you are cared for. And from that space, we give as doctors and we provide care and generosity and healing to others. And that still sticks with us today. And this kind of a tangent, but I believe that that heart is there for physicians to care and to give. But the current healthcare system has made it harder for doctors to do that, in the fact that doctors are less able to be nourished themselves. I'm not really quite sure how and why it happened. I'm not talking about the healthcare system today, but in short, I believe there's increased expectations, increased restrictions, decreasing rewards, meaning a personal sense of having an impact, and a decreased sense of being impactful, and decreased sense of being respected, and that you have a place and meaning as a doctor. But my tangent for that is over. The type 2 space is giving and nurturing and being generous to others because you feel the people around you, the world, the universe cares for you, has nurtured you and nourished you, and continues to do so. So it is from this space of I'm loved and needed and part of things, and then giving from that space. The danger for the type 2 physician is when you're no longer feel nourished, or no longer feel nurtured, and feel not needed. And then the more ego-y fixated, that's the Enneagram language we use, the ego fixation of the type 2 comes out to give and serve in a way that's intended to get something back. So let's give the example of the physician who, let's give an example of one physician, the same physician, but let's compare these two different, not sides, but two different, how to say, actions of the same physician and where they're coming from. So let's say you, or a type 2 physician, is looking out for their colleagues and says, "Oh, hey, you looked busy, so I took that last patient for you." Or, "Hey, you look thirsty, here's a water." Or, I took care of that for you, don't worry about it." Or or they may be the one that others rely on. "Oh, I have this game to go to or whatever, and I'm on call," and you may say, "Oh, okay, I'll take that call for you." And ideally, This will be done out of a very nurtured and loved and nourished space, right? That's what the type 2 is about. But if the type 2 is more depleted, they actually don't feel nourished, don't feel nurtured, and actually may feel unneeded. The same actions may be done in order to catch the attention of others and to almost be able to say, "Hey, I helped you out in the past." In their mind, they may think this or unconsciously, and how come you're not giving back to me, or how come you're not kind of responding and giving me the kind of thanks that I deserve? Even though they may say, "I don't need your thanks. It's okay. It's fine. It's no problem." And that's, I would say, something that happened to me when I was transitioning out of working full time for a hospital, where I felt like I was giving more and more, but I wasn't feeling nourished and nurtured. And I actually took on more projects and more things to do, and signed up for this role and this job and said I'd do this. And in a way, I think I was expecting some sort of praise. Oh, hey, Dr. Yu's doing all of this stuff, and maybe I did receive some praise. But in reality, I was trying to get re-nourished and re-nurtured. And, long story short, that didn't happen, and I ended up kind of changing my job situation. So the lesson for type 2, from type 2 for all of us as givers, whether it is in our job or career, profession, whether it's at home or in general, we need to give from a space of having things to give, of being nurtured and nourished. If we keep trying to give out of a space where we don't have, that just ends up in a sad story for everyone, because then you may end up doing things and helping others, actually expecting some sort of something in what am I trying to say? Something in response, some sort of trade off. Hey, I'm going to do this for you, so I want you to thank me and say, "Hey, this person's so awesome. Doctor, you're so awesome because he always helps me out, even though he doesn't need to." So the key here is to get re-nourished, re-nurtured, and sometimes this word may seem like a bad thing, but it's not. Retreat, or if you want to think about it this way, you're treating again, like retreat. You're retreating to remember and realize how nurtured and nourished you are. But if you keep giving in a space where you're not able to retreat, and then you're constantly depleting yourself. And I would say that is a big lesson, the Enneagram Type 2 lesson, in particular for those that are Type 2, but really for anybody. And in such a giving profession, I think this would be very important for all of us to hear. So in conclusion, in summary, remember, realize that you're important, right? You have an identity, a value, a significance, of being loved, of being needed, of being nurtured and nourished by people around you, by the world, and just think of all the people that have loved you and cared for you, and how you're cared for just by, you can breathe, you have, you can eat, you have a body that keeps you alive. So getting back to that source of being loved is the lesson I'm giving to you today from an Enneagram Type 2 space. And from this space of realizing you're loved and nourished and nurtured by it all, from there you can nurture, nourish, and give to others, and provide for others, and be generous. Now, this applies to all people, but definitely to Type 2s. If you're not sure what type you are, that's actually okay. But definitely knowing your type helps you with personal development and wellness and wholeness a little bit more. So if you're curious to find out what type you are, you can contact me. I help physicians figure out their Enneagram type and help them with their self awareness and personal discovery. You can message me. You can also go to www.theenneagramforphysicians.com for just more information on what I do with the Enneagram. And in the other Enneagram Type 2 physician video, I talk about some more practical approaches, how Type 2 self sabotage, how they get into imposter syndrome, and practical ways to personally develop. So I'll see you in that video. See you next time.